I'm Gary Slyman, President and Founder of Great Transition Strategies. Today's topic, burnout in the medical profession and coaching as one potential intervention. Did you know that physicians experience burnout at twice the rate of the normal workplace in the United States? A Washington Post article talking about burnout in all professions, 62% of the healthcare respondents said they were burned out. That's a lot of folks. If you're a leader in the healthcare profession, or if you're someone who's being burned out, you see your colleagues, if you could reduce the level of burnout by 25%, would you do it? 20%? 15%? 10%? Coaching is one of those interventions that can help you get and reach those numbers. So let's talk about it. I'm going to look specifically at a study and relate some data with you. Here's data from a study with a control group. So first, what is burnout? World Health Organization defines it as having these three elements, and it's a syndrome, not a medical condition, but this syndrome causes a lot of stress and can cause other medical conditions. Number one, exhaustion in the workplace. It could be mental exhaustion, but you're exhausted with the workplace. Number two, negative feelings towards the workplace, negativity, cynicism, you no longer enjoy what you're doing. Lastly, lack of efficacy. You're not as effective as you used to be, or as you need to be or want to be. So those are the three elements. One study, I took almost 90 doctors, and 90 doctors received one-on-one coaching. And they were experiencing burnout, and when they put this group together, they had a control group, no coaching, and another group that received coaching. One-on-one individual coaching. Of the group, they're talking about now exhaustion. The group that received coaching, they reduced their level of exhaustion by over 19%. 19%. And the group that received no coaching, it increased by 9%. So it's like a 28% difference. Extremely significant. Overall burnout, that's putting all those three elements together. The group that received coaching, it reduced them by like 17%, just over 17%. And the control group, no coaching, increased over 4%. 22% difference. Just by individual one-on-one coaching it was 6 sessions. First session was 1 hour. The remaining 5 sessions for half an hour. 3.5 hours of one-on-one contact by those individuals gave those kind of numbers. That's not a significant amount of time when you think about sending people to classes, traveling to courses, doing those kinds of things. And in many cases, you could do coaching during the workday. Half-hour shift, take a half hour out, and we're going to pay you during that time, and you're going to do your coaching during that time to help them. So I think there's a number of ways you can do it. I'm going to give you 3 things to consider. So first, let's just hit pause for a second and talk about what are the drivers of burnout. The research has it, there's 6 elements or 6 drivers for burnout. Number 1, workload. No surprise there. Control or lack of control, the individual not having control over the work environment. Recognition, rewards. Next, community, values of the organization, and community. So when you put those 6 together, those are what drive it. A lot of those sound to me like leadership issues. So coaching can come in at any level, at the health care facility or the overall organization, all the way down to the individual. You can intervene at any place. One-on-one coaching. You can do one-on-one coaching with the person who's receiving it, or who's being burned out, which is what we just talked about, the physician being burned out. Or suppose you went to the next level, the person who's supervising, who contacts a lot of folks, did one-on-one coaching to understand how they're affecting the drivers. To me, I think that's where you will make the most bang for your buck there. I think you can make a lot of headway at that particular level. But you can go up to the next level of supervisor, facility. You can do one-on-one coaching at any level. Next, second intervention on coaching, group coaching. Group coaching is really individual coaching in a cohort format. You come together as a cohort in that format, for a period of time. And you decide the period of time. Come together, they're working on their individual goals, individual progress, but they're doing it in a cohort format. One of the benefits of group coaching, reduce cost, think reduction of 30, maybe 40%, and the relationships that are built within the organization. You're in a cohort, they're working together, it can break down barriers. I've seen that happen, so that can be beneficial. Last, think about a team to prevent teams from having burnout, because you have a number of groups that work as a team. How can you reduce the burnout in that team? Team coaching. Work with the team and how it's formed, so that way you can make sure you cut out those 6 drivers or you reduce those 6 drivers. Or how does the team deal with it? Put the conditions in place so the team knows how to deal with it. So what do we do here? Talked about the level of burnout in the medical profession. And if you are a supervisor in the medical profession, you know what it's doing to you and you know the cost. So we talked about that. Gave you some specific data on an intervention that worked. Coaching did work one-on-one. And now I gave you 3 ways to think about, here's some considerations. One-on-one coaching at what level? All the way down to the individual being burned out, to the top of the organization. Group coaching, individual coaching in a cohort format, and team coaching to work with teams. Hope you found that helpful. I look forward to an opportunity to work with you and help you reduce burnout in your organization.